From now onwards, don't practice on computer. You'll get 450. Trust me. The person who has, okay, who is going to deliver you, okay, into the exam. From now onwards, don't practice on computer. So we are going to switch fast for 10 minutes, very fast. Hello and welcome to Grandmaster class, and this is Peter Simon with you, the trainer. Today we are going to learn about the lesson essentials of do's, don'ts, and the general information. Some tips, tricks, and suggestions. Do not ignore. These are very important. They are vital, blood running into the listening. The questions. The listening subtest is the first test in the OET examination. Many people have many questions. So this is one big question. Why listening first? I'm telling you now. Because there are some students who start with reading. Your mind is not ready for reading. No way. Directly you take reading, your mind will not. You have to. You understand, when you cook food, no? First you will put oil. When the oil is very hot, then you will put some things. Onion. Nobody will put onion first and then oil. They'll think you are a crazy fellow. Yes. You are a good cook, maybe. Okay? You are a good cook, maybe. You know better what I am talking. First put the oil, and when it becomes hot, at the appropriate or appointed time, you put onions. Okay? There is timing for everything. First listening. Even any exam you take, it's the same follow method, because it's experts did research and they have, okay. So gear 1, listening. No need to move your eyes much. Only ears. No need. Eyes are not involved much. That means only one through ears. That's all. Too much of ears. But when reading comes, close this everything. Then eyes will start. So in the beginning, only eyes, little action is there for listening. Only read some few. But now mentally you are ready to read. Then reading comes. Afterwards, writing, full you have to, okay, rake your head. R-A-K-E, rake your head. You know, in the farm, they'll rake with the instruments like that. So 3 parts in the OET listening subtest, part A, part B, and part C. So altogether 42 questions in the official OET. The tested duration is 40 minutes, approximately. Not exactly, approximately. Audio recordings. You hear each recording once only. That means no second time. That is what it is. The recordings will not be repeated under any circumstances. 3 separate parts in the listening test. So practical approach, the left points are more important. Practical approach. What do you mean by practical approach? Practice means practice all these 3 parts daily. Not like testing. Practice. What's the difference between practice? The theory is what I am giving. Theory is what I am giving. Practice, then test. So when you go to, many of you are Yeah, all of you are biology students. You know biology, dissection, cockroach. 1984, I used to cut frogs, cockroaches, all these things. Okay. So, first the lecturer explains everything. So theory part is over. Theory part is over. Then they say, now go to your desk and all the trays are there. So now take the scissors and open up everything, digestive system. I remember even now this, just in front of me. Even the buccal cavity, okay, mouth organs should be put everything and put in the slide and shown. They used to give marks. So first one is theory. That is what I am telling you how to do. Theory is more important. Approach I am telling you, practical approach I am telling you. Theory is very important. You should learn how to approach these questions. Okay. That is called preparation. Preparation stage. That means I am preparing you and teaching you how to do different things. Just now I have shown you got 7 out of 7. I'm preparing you. Okay. The first 1 hour which I have taken, that was very important. So theory is very important, how to approach this question. Then after learning from me, then you should go for practice. What is practice? Practice means take a test and do it in the limited time. So 40 minutes means 40 minutes only you do. Finished. Keep it aside. Now take extra time and try to study. You don't check your answers. Ask somebody to check your answers who is not insane, who can do it correctly. Not everyone can correct your answers because this is OET exam. That means otherwise everyone can give you OET exams. Okay. So give them to those people who can correct. For you people, I am there. I will correct it. It will not take much time for me. Printer is here. I'll take print and I'll give very fast. Okay. That's not a big problem. But the problem is in you. Okay. So you practice for 40 minutes. Take that answer sheets and send it to me. Finished. Then take reading, do it in 1 hour and send it to me. Then take writing, 45 minutes, send it to me. Sir, my work is finished, sir. You correct, sir. Finished. Yeah, you are finished. Not your work is finished. You are only finished. What do you mean difference? Your work and you. Try to understand. Okay. You are not wise enough. That is why I told practice. Practice means after submitting the papers, take the papers, keep in front of you and see what you can correct. Yesterday there was one girl, okay? I don't remember her name. No, I don't want to tell her name now. Not remember. Now I remember, but I don't want to tell. She told me, sir, I have written. When I am typing the letters, I am changing the style. Sir, now I am studying. I felt very happy. How many of you told like that? I actually want to take the name of that student, but without their permission, I cannot take. Okay. So, what I mean to tell you is not appreciation. That deserves appreciation. No, not appreciation. That deserves recognition. It's not appreciation. It's the fact. You appreciate somebody, okay, when they go beyond a mile and help you. Not when what they have to do, then they do, you don't appreciate. For example, somebody says you are good, you are excellent, means that is true. And a person like me will not appreciate anybody. That's a fact. So what I am telling you is, take the papers, listening, reading, writing. Sorry, my leg hurts a little, so don't. So, now here, take the reading, listening, reading, writing. Now, earlier it was limited time, but now unlimited time. Take the listening question paper and underline each and every word you don't know. Underline them. Actually, while doing listening only, you could have underlined. If you are wise enough. And now you will not underline. But what you will do is, you will find out its meaning, spelling, pronunciation, word forms, and usage. If you do like this, I challenge you, within 1 month, you can go for the exam. Sir, I don't have time. That is your problem, not my problem. If you have stomach pain, you have to take the medicine, not I. Okay? Don't tell me also. Excuses are given by those who feel that they are self-defeated. They already accepted defeat. I cannot do, sir. I don't have time, sir. They're self-defeated. Even before the battle is begun, he's a defeated soldier. Better throw him out of the battle. Such people don't deserve to fight in a battle. Battles are for warriors. Battles are for warriors. Go and ask the soldiers. They will tell you what is battle. Okay. Right. So, learn these things. And then, now, after finishing all these things, don't wait for the marks. Sir will correct and give. Every word, everything, line, mark, draw lines, draw arrows, draw everything. This is called study. That girl said, when she told, sir, I am studying, my heart gave a jolt. I feel really proud, such students. Okay, I'm not appreciating, I'm recognizing the fact. And don't fly in the sky with wings. Okay, there is nothing, no wings. I'm not giving you wings to fly in the sky. So, everyone, then what you have to do is, do the test again. Do the test again. You see drastic difference. Drastic difference. And now the words, the sentences, the things will be making up some powerful frameworks in your brain. So second time. Done. Send it to me again. Okay. Send it to me. Not everyone will do, I know. Nobody will do like this. There will be only some very handful of students. But I challenge you, you will make me proud tomorrow. Okay? Then finished. Then first round has come. So how many marks? 26, 30, whatever marks. Then second round also will come. Then what are the mistakes still there? Those 4 or 5 things. They are very difficult questions. Now go through them. Again. And only those questions you redo. 3 or 4 questions. Finished. Everything. Those questions you do and call me, Simon sir. I need your help in these 3 questions. Can you please explain me these 3 questions? Oh, I will get wings. You understand? That's what I want. That is called practical approach. So testing comes next. Testing comes next. So when you go to the real test, that is the testing. This is only practice. Okay. They only practice. So theory, practice, and the final test. It is called preparation, planning, and production. Preparation, presentation, and production. Now preparing with me. Okay, presenting in your test and production in your marks and you are getting the exam. So these are the three differences. So be prepared before the test day by doing all these things. Familiarize with each format of the test. All of the listening content is appropriate for healthcare professionals in all the 12 different professions. Same material, no difference. Content means subject is the same. Subject is the same. Now commonality. What do you mean by commonality? The listening subtest does not require special knowledge or specialist knowledge. You need not be a nurse. Enter everything about a nurse. Doctors don't know everything what a nurse does. And nurses don't know everything what a doctor. So doctor's knowledge is different, nurse's knowledge is different. Okay, it's totally different. Different areas. So a doctor doesn't need to know the specialty of nursing or podiatrist or anybody. No any specialty. That means every profession, people belonging to each and every profession knows that. That means it is common to all the 12 professions. So don't give difficult areas, they give ordinary areas, which any profession can answer. No special knowledge in any particular healthcare. It's common subject. Common subject. Anyone can understand. Now, criteria. The listening content tests the candidate's level of English language proficiency in a healthcare specific environment. So, what is his level there? It is testing, test-based exam skill. Test-based skill. It will test you. Does this person know vocabulary? It is not answers. You are thinking that you are giving answers, but they are thinking something else. Does the candidate know that this is hyphenated or not? Does the candidate know that singular or plural? Advice, you write. ADVICE or ADVISE. Okay. If A and an is there, you have to write ADVICE. Okay. And advice. So try to understand that one. No. Some advice, not a advice, not an advice, not two advices, three advice. There is no one, there is no two, there is no many. Try to understand the difference here. Some advice. I gave him a piece of advice. I gave him some advice. There is no an here. Okay. So in the noun's position, it is there. Okay. Then it will be CE. If it is verbs position, he advised. He is the noun. Advised is the subject. Advice was provided. He gave some advice. Gave, already verb is there. Advice is a noun there. So see, verb is SE. So remember that one. So he's testing you these things. You don't know that. You don't know. He's testing you which. Can you identify whether it is noun or verb? That is, such words only he gives in the exam. Whether singular or plural. Article or no article. Spelling. So that is the criteria. You don't know that. Just giving answer one word, two words like that. That is not the point. He is testing you whether you know the pronunciation of that word. Whether you know the spelling of that word. He's telling schizophrenia. He's testing you whether you know the spelling or not. He will not give you mark. 1 second. So, analysis. Now let us study the three parts of the listening subtest separately. What test? Part A expects what? Part B expects what? Part C expects what? There are two different consultations in part A. Two different consultations. One is a dialogue. Okay. Now let us see. Consultation. Both are consultations between two healthcare professionals or with a healthcare professional and patient. Consultation between a healthcare professional and a patient. So two patients will be there and two professionals will be there. It may be physician, it may be nurse, it may be cardiologist or surgeon or whatever. So consultation. In each consultation, a healthcare professional is talking to a patient. Okay. It may belong to any department, maybe podiatry or related to eye problem or heart problem or diabetes or anything it may be there. General information, not specific information. Just ask. In each consultation, there is one note completion activity. So there will be given notes and it is incomplete and you have to complete with 2 words or 3 words or 1 word or whatever, word or a phrase. There are 12 fill in the blanks. The duration, the part A lasts 10 minutes. Part A lasts 10 minutes. First consultation is for 5 minutes. Next consultation is for 5 minutes. So this is assessment. Part A tests the ability to understand and record specific information about the patients. So part A tests the ability to understand and record specific information about the patients. Part B, there are 6 different extracts from various situations in the workplace. So each extract, okay, so it will be around 10 minutes. Part B. In each extract, you hear health professionals either talking to each other or to a patient. Nurse talking to a doctor, senior nurse talking to a junior nurse, or to patients, anything. So activity, there is one multiple choice question to answer regarding each extract. One multiple choice question. Part B lasts around 10 minutes. That means 6 questions, 10 minutes. 6 questions, 10 minutes. That means less than 2 minutes for each question. So 1 minute, 40 seconds, something like 1 minute, 40 seconds. Now assessment. Assessment. So first one, test the ability to understand. So whether are you able to understand, for example, suddenly you go to UK, you'll get a job there and you will not understand anything because you don't know English properly. So the patient will be telling something and you will be doing something else. Okay. He asks grape juice, you'll give water, something like that. So you don't understand. Everyday workplace interaction. So how are you going to deal with such situations? Emergency cases. In the middle, they cannot explain you. Just they'll give something. Immediately you have to follow, implement. So you have to be ready to understand each and everything. Yesterday, yeah, I hear many people tell me many stories, many things, many real life situations also. Stories are there, real life situations are there. So when you feel for the patient, you do the best service for them. When you feel for the patient, you do the best service for them. That feeling should there. Your heart should beat for the patient. This is my patient. I have to give him my best. He trusts me. So I have to give everything possible for him. Like that. So you have to be ready to understand what they tell. That is the interaction. You have to have that, rendering ear. You have to render the ear. That means you have to give patient listening. Okay. I'm teaching something. Not everyone has that patience to listen. Right. You hear 2 longer recordings in part C, very long recordings. Okay, that is 5 minutes, 5 minutes. So 10 minutes, part A. Part B, 10 minutes. So 20 minutes over 10, 10, 20 minutes. Over. Part C, 20 minutes. Okay, there are 2 long, each one is 10 minutes. Each recording is either an interview or a workplace presentation on a topic related to healthcare. So is it an interview or a workplace presentation? Interview means easy. Workplace presentation means difficult. How come? What's the difference? Interview means some lady will be asking questions and a gentleman will be answering questions. That is interview. Hello, doctor, what do you think about this problem, this disease? So the male doctor will be told. Or a male interviewer will be there and a female. So because of this interchange of genders in speaking, participation in speaking, you will be easily understanding when is the question changing. So the interview asks, so the question will be changed. Every time the interviewer asks the question and the answer will be given by the interviewee. The interviewer will ask, okay, nurse will be asking the doctor, doctor, what is this? Or something like that. Okay. Or patient is asking the doctor something, how to do like that. So it's discussion, dialogue, 2 persons. So one interviewer and one interviewee together, if they speak, that is one question finished. Then again the interviewer tasks, the second question starts. So it is very easy. Many people told me the same. Yeah, of course it is easy. I agree with you totally. But if it is a presentation, it's difficult because only one person is talking like how I am talking. You don't know when the topic is changing, when the slide is changing, when the question is changing. So then what happens? There are some markers and pointers. Okay, first let me tell me about a patient, blah, 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 blah. Finished. So this is introduction part. Okay. Then he'll say, okay, now let me give you an example of a patient named so and so. So that means next he will talk about the diet. Next he will be talking about the medication. Next he will be talking about exercise. Lastly he will talk about review. So like the topics change. So in the first sentence only you will understand. And before that first sentence he will pause. It's not pause, it's a stop for at least 30 seconds. One topic to another topic, like one paragraph to another paragraph, there is a line. One topic to another topic, subtopic I mean. He needs a break. And he will take 30 seconds. Or at least 10 seconds. And then he starts. Okay, now regarding the medications. Then I will discuss with regarding the exercises that you have. So the first part, first sentence itself, you will understand what he's talking about. Because of that, you can change the question. So be careful. There are 6 multiple questions to answer about each recording. Okay. First recording 6 questions. Next recording 6 questions. That means 10 minutes, 6 questions. Same like part B. 1 minute 40 seconds roughly. This part lasts around 50 minutes. But in part C, what happens, In part B, it is very easy to identify that because there is beep sound. But in part C, there is no beep sound. So chances are there. Part C, third question is going on and you are still in first question or second question. It may happen like that. So be careful. Be careful. That is the problem in a lecture. Okay. So this part lasts around 15 minutes. Okay. Now objective. Part C tests the ability to understand the speaker's ideas and experience. It's not just why he is talking like that. What is the reason behind this? That type of questions. Intellect is very much needed. Your bulb should be on. Electricity should pass there. Okay, it's not direct question. It's indirect questions. So before each recording, you hear information about the context and instructions about what you have to do. So now this information which they tell is also printed on the paper. You can say, now you will hear a radiographer talking to a patient like that. This is coming from the audio, and this will also be in the paper. I showed you number of times. Even before the question starts, it will be there. So that will be coming from the audio and also the questions. Pre-listening. Pre-listening. Before each recording, you have time to read through the questions. He will say, there are 3 stages: pre-listening, while listening, post-listening. This is pre-listening. Before the beep sound starts. Before the beep sound. Now you have 30 seconds to look at the questions 7 to 12. And this fellow, this mud brain, he will look that side. What is that fellow doing? What is this fellow doing? What is that invigilator doing? Why 2 invigilators are there? One is not sufficient or not? All nonsense you'll be thinking. And when the audio starts, you'll be looking at the audio recorder. Crazy fellows. In this 30 seconds, what we have to do is take your paper, keep it in front of you, and study the questions. Underline the important words, keywords, just like how I was underlining, highlighting colors, yellow color, underlining something, draw lines, underline something. Do whatever you want. This is related to reading, listening, both together, because listening comprehension. Listening is reading without the script. Listening is reading without the script. And reading is listening with the script. Same thing. In listening, you'll have audio. Okay. In reading, you'll have the paper in front of you. Remove the paper and put it on the audio. It is listening. Remove the audio and put it on the paper. It is reading. There is no difference. This is listening comprehension. This is reading comprehension. Everything is one and the same. So that's why this applies to reading also. So what all I explained here, I will not explain again there. But what is different, those only I will explain. Okay, next. So before each recording, you have time to read through the questions. But many people know, not yesterday, 3 days back, one student told, yesterday, sir, like what you told, no, I did not know what to do in that empty time. So now there is a pause and the recording is paused. So what should I do? I did not know. So I just was looking here and there, sir. But now I understand, sir. You have told, no, I am following that. Before the beep sound starts, I am underlining and checking. Now I am getting good marks, sir. I feel very happy. I feel very happy. Why don't you share your feelings and realities with me? If you have pain, won't you? If you have pain, won't you go to your father or mother and tell her? Then you have pain regarding subject, okay, regarding English. Won't you come to me and tell me? What wrong did I do to you? Did I do any injustice to you? In fact, I am so much caring and loving, so much affectionate I am telling you. Come on, anybody is there, call me. Anybody is there, call me. Anybody is there, call me. Nobody raises their hands. No? Why? Oh, Mr. Simon is like a leech, you know. He will take all the blood out of me. He'll fill his stomach and he'll be happy and he'll take 2 hours, 3 hours. Why should better not to contact Simon? Say, better put my hand down. Wow, wonderful solution to an everlasting ending. Wonderful. Great. What is the everlasting ending? Fail. Good. Enjoy. What I can do? Huh? So, Guess. Now in this time, you guess. Brainstorming. What are these words? Now here, the word is problem. Now in the audio, will the same word be there? Will the same word be there in the audio? No, definitely no. Definitely no. If some same word is there, it's well and good. But if the same word is not there, then what am I supposed to do? Okay. Yeah. Problem. Immediately, your brain should start working. What is that? Problem, difficulty, concern, obstacles. So some words you mind will think. Write down there, no, immediately with a pencil towards one side. Towards one side, write down. Okay. Brainstorming. And think about what you are going to hear. So, prescribed dash. Prescribed what? Dash. Antihypertensives. Antidepressants. Okay. Something, whatever you think will come. Write down there. No? Noun will come or verb will come or adjective come. Noun comes right N. Verb comes right V. Adjective comes right A. Write down there. Singular or plural. Singular comes S. Plural comes P. NS, noun singular. NP, noun plural. You don't have any marking, lining, anything. Even a carpenter who is uneducated, no. He makes some lines. This is left, this is right, this is top, this is bottom. But on the wood, after chiseling and after, okay, making this level smooth, he will write on it L. L means left one. R means right one. This side up means up. Down means down. D. Okay. Left, right. In the middle, he will write up, down. Up means this one. Down. So left. This is left, up, down. This is right, up, down. See, even a carpenter will make some markings. Why are you not making? You're a nurse. You're educated. Carpenter who doesn't have proper education is doing all these things. And you are educated. Why are you not doing all these things? That is called guesswork. Okay. To avoid future problems. Suddenly the word comes, you don't know what to do with that word. If you write and keep something, at least some idea you will get. So be careful. So now, because if I go on giving the lecture, no, then afterwards you will not listen to these important things. So I halted that one and I gave these important things. Now I am going to give. This is for the general students. And now the most crucial information is coming. Questions number 8 to 14 or something. Okay. Now,